What if the way you masturbate, something you have done your entire life, is now quietly destroying your erection without you realizing it? Let me ask you directly, have you ever noticed that your penis gets hard slower, loses rigidity faster, or doesn't stay firm the way it used to during masturbation? Most men think the problem is age, testosterone, or stress. But in my clinic, I've seen something far more common and far more overlooked. 3 specific mistakes in masturbation can weaken the erection, reduce penile sensitivity, and sabotage your sexual performance over time, even if everything else in your health is normal. I'm Dr. Emily Collins, urologist, and before we go deeper, I want you to understand something that men rarely hear clearly. Masturbation itself is not the enemy. Sex is not the enemy. Your penis is not failing you. What destroys your erection is the technique you use, the pressure you apply, the speed you condition your nervous system to expect, and the friction that silently damages the skin and blood vessels. When men over 50 tell me, "Doctor, I can still get hard, but it fades, it doesn't stay strong," they are describing these mistakes without knowing it. The erection becomes weaker because circulation declines, nerves fire differently, and the penis responds more slowly to stimulation. Your body is still capable of strong erections, powerful sexual response, and deep pleasure, but only if you stop treating your penis the same way you did at 20. After 50 or 60, the tissues are more delicate, the nerves are more sensitive to stress, and the smallest habit can change how your erection behaves. And this is why understanding these 3 mistakes matters so much. When you masturbate with excessive grip, extreme speed, or dry friction, you condition your penis to need unnatural stimulation, something your partner or your natural arousal cannot replicate. Over time, your erection becomes dependent on that artificial pattern, and your rigidity drops. Many men blame hormones, pills, supplements, or age, but the truth is that the hand technique alone can weaken the erection. And once you know how this happens inside the penis, you can correct it and rebuild your natural erectile response in a way that feels stronger, more controlled, and more reassuring. You might even be surprised by how quickly your penis reacts once the stimulation becomes aligned with what your body actually needs now. You ever experienced this? If so, tell me in the comments, because understanding your own body is the first step to improving your erection naturally. And while you're here, make sure to like this video and check if you're already subscribed, because what you're about to learn in the next part might genuinely change the way you approach your sexual health. And as we continue, things will become even clearer as we move toward correcting these habits so your erection can respond with more strength and confidence again. When you understand how those habits interfere with your erection, the next step is seeing what actually happens inside your penis every time you masturbate. Most men never learn the biology behind a strong erection, and without this knowledge, it's easy to repeat patterns that quietly weaken rigidity over the years. Inside your penis, there are 2 chambers called the corpora cavernosa. They are like living sponges that depend entirely on healthy blood flow, responsive nerves, and flexible tissue. When you become aroused, nitric oxide increases, the arteries open, and these chambers fill rapidly with pressurized blood. That pressure is what gives your erection its firmness and staying power. However, as you age, the tissue becomes less elastic, the arteries narrow slightly, and the nerves that trigger arousal require more consistent stimulation to respond fully. This means that the way you stimulate your penis matters more after 50 than it ever did before. Every touch, every rhythm, every movement sends signals through the pelvic nerves to the brain, which then communicates back to the penis to maintain rigidity. If the stimulation is too rough, too fast, or too inconsistent, those signals become disorganized, and the erection loses its strength sooner than it should. Many men describe it as feeling strong at first, then fading, which is a sign of disrupted blood flow and overstimulated nerves. The penis is trying to respond, but the system becomes overwhelmed and cannot maintain the same level of firmness. Another important element is the endothelial lining, the delicate surface inside the arteries that supply blood to the penis. With age, this lining becomes more sensitive to friction, tension, and inflammation. When masturbation techniques create unnecessary stress, the arteries react by tightening instead of relaxing, which reduces the amount of blood reaching the erection. This is why some men feel their penis swell weakly or lose rigidity halfway through stimulation. It's not lack of desire or lack of masculinity, it's circulation being disrupted by habits that used to feel fine decades ago but now work against the natural physiology of an older body. The nervous system plays its role as well. At younger ages, nerve endings fire rapidly and intensely with minimal effort. But later in life, they need deeper, slower, more deliberate forms of touch to build sustained arousal. If stimulation happens too quickly, the brain doesn't have enough time to interpret the signals properly, creating a disconnect between physical contact and sexual response. This mismatch becomes one of the silent causes behind weaker erections during masturbation. Understanding these internal mechanisms allows you to see why the next mistakes, the ones men repeat most often, have such a powerful impact on erection quality. And once you recognize how these patterns affect the penis from the inside out, the path to rebuilding stronger rigidity becomes much clearer as we move deeper into the habits that need to be corrected. As you begin to understand what happens inside the penis during stimulation, it becomes clearer why the same techniques that worked perfectly at 20 or 30 start to fail after 50 or 60. At younger ages, erections depend far less on precision and far more on the body's natural biological momentum. Hormones surge effortlessly, blood vessels respond instantly, and nerve endings fire with high sensitivity even when the technique is rushed, forceful, or repetitive. The penis at that stage behaves like a high-performance engine that starts reliably even when treated roughly. But as you age, that engine requires a different kind of care, and ignoring that shift is one of the most silent reasons erections weaken during masturbation. When you were younger, speed didn't matter as much because your nervous system could amplify weak stimulation into strong arousal. Even a brief moment of touch could trigger a full cascade of blood flow. But later in life, your body no longer translates rushed stimulation into the same level of erectile response. The penis needs a buildup of signals, not chaotic bursts, and the nervous system needs time to coordinate blood flow, muscle contraction, and sensitivity. If you continue using the fast, forceful rhythm from your teens or 20s, you overwhelm that system instead of activating it, which is why the erection now fades or never reaches the same level of rigidity. Grip strength is another major difference. Younger tissue is resilient, thick, and highly tolerant of pressure. It recovers quickly and maintains sensitivity even after rough handling. But after the age of 50, the skin becomes thinner, circulation becomes more fragile, and the nerve receptors require gentler stimulation to fire correctly. The old habit of squeezing hard to intensify sensation creates the opposite effect with age. It compresses blood vessels, restricts circulation, and desensitizes the very nerves responsible for maintaining an erection. Many men don't realize this and end up gripping tighter and tighter, thinking they need more intensity, when in reality that pressure is training their penis to go numb. Another shift is arousal pacing. Younger men can jump instantly from zero to maximum stimulation without losing momentum, but older men need gradual buildup. The penis responds best when the nervous system is eased into arousal rather than forced. The slow, controlled rise in blood flow is what creates stronger rigidity, but old habits push the body too quickly, causing the erection to collapse before it stabilizes. This is why the same technique that once produced powerful erections now results in weaker swelling, inconsistent firmness, or sudden loss of rigidity. And finally, lubrication becomes essential with age, even though many men avoid it out of habit, pride, or discomfort. Younger bodies naturally tolerate friction, but older skin cannot handle dry stimulation without triggering microdamage that weakens the erection over time. What once felt normal can now irritate the tissue, disrupt blood flow, and dull sensitivity in ways that sabotage your ability to stay hard. Understanding these differences sets the stage for identifying the most harmful habits men repeat without realizing the consequences. And once you see how these old patterns conflict with the needs of an aging body, the next mistake becomes impossibly clear as we move deeper into the first major habit that silently destroys your erection. As you begin recognizing how age changes the way your penis responds to stimulation, the first major mistake becomes unavoidable to see. Excessive pressure, something most men do without thinking, slowly weakens the erection in ways that are almost invisible at first. Many men grip the penis tightly because they want more intensity, more friction, a stronger sensation. But after 50 or 60, the penis does not interpret that pressure the same way it did decades ago. What once enhanced pleasure now compresses the blood vessels, restricts circulation, and reduces the sensory feedback your brain needs to maintain rigidity. Inside the penis, the arteries that bring blood to the erection are extremely delicate. When the grip becomes too strong, these arteries are squeezed, limiting the inflow of blood at the exact moment the penis needs it. The result is that the erection appears firm at the beginning but loses strength quickly, fading before you want it to. Many men describe this as the penis swelling but refusing to stay completely hard. This is not a hormonal failure. It is a mechanical consequence of too much pressure blocking the essential blood flow required for rigidity. The nerves also suffer. When you apply excessive grip, the nerve endings on the penile shaft become overstimulated and eventually desensitized. This reduces the quality of the signals sent to the brain, weakening your sexual response. Over time, this repeated compression conditions your penis to need stronger and stronger pressure to feel anything at all. But the more pressure you use, the less sensitive the penis becomes, creating a vicious cycle that sabotages your erection without you noticing the damage as it happens. This also affects the tunica albuginea, the elastic layer that allows the penis to expand and trap blood during erection. Too much pressure can strain this tissue, reducing its ability to stretch evenly. When this happens, the erection feels soft in certain areas or bends more noticeably during stimulation. Small distortions in expansion may not cause pain, but they directly weaken your ability to stay fully hard. Men often mistake this for age-related decline, when in truth it is the accumulation of microstress from years of gripping too hard. Additionally, excessive pressure disrupts the pelvic floor's natural rhythm during arousal. The pelvic muscles should contract smoothly to support blood retention, but when the grip is too intense, the body responds with tension rather than coordination. This can create a sensation of the penis shutting off, causing the erection to drop suddenly even when arousal is still present. All of this reinforces a simple reality: a tight, forceful grip is one of the most erection-damaging habits men carry from youth into maturity. And once you understand how this pressure alters blood flow, nerve sensitivity, and tissue flexibility, the next mistake becomes even more revealing as we move into the hidden habit that trains your brain to expect stimulation your body can no longer replicate afterward. Once you understand how excessive pressure weakens your erection, the second major mistake becomes even more revealing. Most men never realize how much the speed of their masturbation conditions the brain, the nerves, and the penis to respond in a very specific way. When stimulation happens too fast, the nervous system adapts to that rapid, high-intensity pattern. And over time, it begins to depend on it. The problem is that this rhythm is artificial, something your partner cannot reproduce and something your natural arousal cannot sustain. With age, this mismatch becomes one of the strongest invisible causes of weaker erections. When masturbation is rushed, the sensory signals travel to the brain in chaotic bursts instead of a steady flow. Younger men can still process and respond because their hormones are surging and their neurochemical response is extremely forgiving. But after 50 or 60, the brain requires coherence in the stimulation to maintain sexual focus. Fast, erratic movements overwhelm the system and create a kind of sensory confusion. The penis becomes aroused, but the brain does not receive the structured signals it needs to support rigidity. This is why many men feel their erections start strong but collapse halfway through, even though the desire is still there. Speed also affects dopamine, the neurotransmitter responsible for sexual motivation and arousal buildup. When the stimulation is too fast, dopamine spikes quickly but cannot stabilize. This creates a pattern where the brain expects rapid, intense friction to stay engaged. Anything slower feels weak or boring, even if the slower rhythm is exactly what the body needs now. The result is a conditioned dependence on speed that does not translate into real sexual performance. Your partner cannot move that fast, and your body cannot maintain that tempo without losing control of your erection. Another hidden effect of excessive speed is what happens to the pelvic nerves. These nerves require a gradual buildup of stimulation to synchronize with the vascular response. Fast movements bypass this natural rhythm, forcing the penis to chase sensations rather than build them. The pelvic floor then contracts too quickly, disrupting the pressure mechanics inside the corpora cavernosa. This causes the erection to weaken, even if you are still physically stimulated. This habit also disrupts the emotional and psychological side of sexual arousal. When the brain becomes conditioned to quick, intense strokes, slower, more sensual forms of contact no longer trigger the same response. Many men interpret this as losing interest or not feeling excitement, when in reality, the problem is that their nervous system has been trained to react only to a narrow form of stimulation. As you age, this conditioning becomes harder to break, and the erection suffers because your body cannot replicate what your brain has learned to expect. Understanding how speed rewires your sexual response makes it clear why many men struggle to stay hard during real intimacy. And once this sink-in becomes obvious, the third mistake emerges naturally, revealing the habit that silently irritates the skin, disrupts blood flow, and reduces erection quality even when everything else seems normal. As the deeper patterns behind speed become clear, the third mistake reveals itself as one of the most silent and damaging habits men over 50 carry into their routine without realizing the consequences. Dry masturbation, especially when repeated for years, creates a combination of friction, micro-injuries, and vascular irritation that directly weakens your erection. Younger skin can handle this stress because it is thicker, better lubricated naturally, and supported by a much stronger hormonal environment. But after 50 or 60, the penile tissue becomes thinner. The natural oils diminish, and the blood vessels become more reactive to mechanical irritation. What once felt normal slowly turns into a habit that undermines rigidity from the inside out. When stimulation happens without lubrication, the skin of the penis experiences far more friction than it was designed to tolerate regularly. Every stroke pulls against the surface layer, creating micro-tears that you cannot see but that the nerves and blood vessels certainly feel. These tiny injuries are not painful, but they build inflammation in the tissue, and inflammation restricts blood flow. The erection then becomes weaker, the swelling less full, and the rigidity less stable. Many men report a sensation of the penis not filling completely or losing strength halfway, which is a classic sign of friction-based vascular irritation. Dry friction also dulls sensitivity. The nerve endings in the penile shaft are meant to glide smoothly during stimulation, not drag against dry skin. Over time, this dragging effect reduces the ability of the nerves to send strong signals to the brain. The result is a muted response where the penis requires more intensity just to reach the same level of arousal. This decline in sensitivity is subtle at first, but combined with aging, it becomes a major cause of weaker erections. Men often interpret this as loss of libido or hormonal decline, when the truth is that chronic friction has numbed the very receptors responsible for maintaining sexual response. Another hidden effect of dry stimulation is how it disrupts the endothelial function inside the arteries. The skin irritation on the outside triggers a defensive reaction on the inside, causing the arteries to tighten instead of relax. This reduces the blood volume entering the corpora cavernosa and interferes with the pressure mechanism needed to trap the blood. The penis may swell, but it cannot stay firm because the vascular system is not opening fully. Even a small decrease in arterial dilation can weaken rigidity dramatically, especially in older men whose circulation is already more sensitive to stress. Dry masturbation also conditions the penis to expect a rougher, more abrasive sensation. During partnered sex or more natural stimulation, the signals feel too soft, too slow, or insufficient to activate the same arousal pathway. This disconnect creates a scenario where the erection seems unreliable, not because of lack of interest, but because the penis has been trained to respond to harsh friction instead of natural touch. Understanding the way dry stimulation affects your nerve endings, blood flow, and sensitivity exposes how this third mistake quietly reinforces the other two. And once these layers become visible, the path toward rebuilding healthier erections becomes far more practical as we shift from identifying damage to applying new habits that restore rigidity naturally and consistently. Now that the three major mistakes are finally visible, the shift toward rebuilding stronger erections becomes far more achievable. What most men don't realize is that correcting these habits is not about stopping masturbation, but about retraining your body to respond in a way that supports rigidity rather than sabotaging it. After 50 or 60, the penis depends on stimulation that respects blood flow, protects nerve sensitivity, and aligns with how the nervous system operates at this stage of life. The goal is not to chase extreme intensity, but to create the kind of stimulation that builds pressure gradually, allows full expansion of the erectile chambers, and activates the brain in a steady, consistent way. The first correction is reducing grip intensity. Instead of squeezing hard, imagine guiding the stimulation rather than forcing it. When you loosen the grip, even slightly, the arteries open more fully, allowing a richer flow of blood into the corpora cavernosa. This improves swelling, responsiveness, and rigidity. Many men are surprised by how much stronger their erection becomes simply by removing the pressure that has been restricting circulation for years. Your penis responds better when it is allowed to breathe, expand, and fill without compression. The second adjustment is slowing down the rhythm. Slow stimulation may feel unfamiliar at first, especially if your body has been conditioned to speed for decades, but this slower pace increases sensitivity rather than diminishing it. As the nervous system adapts, signals travel more clearly, arousal builds more predictably, and the erection stabilizes in a way that supports firmer, longer-lasting performance. What once felt too slow becomes the very rhythm that allows your erection to reach its full potential again. The third correction is adding lubrication. Even a small amount of lube reduces friction dramatically, allowing the skin and nerves to glide instead of drag. This immediately decreases irritation, protects the endothelial lining, and prevents the microdamage that weakens sensitivity. With lubrication, stimulation becomes smoother, more pleasurable, and far more effective at generating full rigidity. For many men, this single change transforms the entire experience, allowing the erection to stay stronger with much less effort. Small changes like these begin retraining your penis in a surprisingly short time. As the nerves regain sensitivity, as the arteries open more easily, and as friction decreases, the body relearns how to produce firm, steady, consistent erections that feel natural and effortless again. And with each improvement, confidence grows, desire increases, and sexual performance becomes more reliable. If you reached this point of the video, it means you truly care about improving your erection and understanding your own body. Leave a comment saying something like, "I am with you until the end," so I know you are committed to this journey. And if the content here helped you see your own habits more clearly, consider subscribing so you can continue strengthening your sexual health with real, science-based guidance. A simple like also helps this message reach more men who need it. And if you want to deepen this transformation, there is another video right here beside this one that expands on techniques your penis responds to even more powerfully, so click and continue with me there.